Hello, you are welcome. Today we are discussing sickle cell anemia, but we'll be talking about the crisis, the types of crisis, the ones that we'll be focusing on. So I'll just give a definition of sickle cell anemia, which is this is a severe, chronic, hereditary hemolytic disorder due to the homozygous presence of hemoglobin S, usually characterized by pallor and recurrent crisis. It is a genetic hereditary hemolytic anemia where red blood cells containing abnormal hemoglobin S instead of hemoglobin A. Okay, since you're focusing on a crisis, you say, what is a sickle cell crisis? So, sickle cell crisis, these are acute episodes used to describe several independent acute conditions occurring in patients with a sickle cell disease. Okay, so what are the types of sickle cell crisis? Okay, so the first one is a hemolytic crisis. Hemolytic crisis, this is a type of crisis which occurs due to destruction of red blood cells over a short time. The loss of red blood cells occur much faster than the body can produce red blood cells. Severe hemolysis leads to low oxygen carrying capacity. The second one is splenic sequestration crisis. Okay, so this is a type of crisis where there is a large pool of blood to the spleen, which leads to splenomegaly. Okay, it can also lead to hepatosplenomegaly. This causes secretory collapse, which may lead to low oxygen level. The third one is vaso-occlusive crisis. So this is a type of crisis which occurs when microcirculation is obstructed by sickled red blood cells. So the smaller blood vessels will be occluded. Okay, the blood vessels will be occluded by the sickled red blood cells. So this patient will be experiencing some pain due to the occlusion of the red blood cells, and there will also be low oxygen carrying capacity of the blood due to the occlusion and the high viscosity of blood. Then aplastic crisis. This is a crisis which occurred due to the bone marrow unable to produce enough red blood cells. This will result to low oxygen tension due to inadequate red blood cells. Okay, so now here are some of the nursing diagnoses that can be used in a patient with sickle cell anemia. So there will be a problem of pain. So we'll say pain related to inflammatory process evidenced by patient verbalizing. The patient may verbalize pain, or the patient may be crying. And you say impaired gaseous exchange related to increased blood viscosity evidenced by cyanosis or evidenced by low oxygen saturation. Then we have risk of skin impaired integrity related to decreased mobility or impaired circulation. And then we have knowledge deficit related to information misinterpretation or lack of exposure evidenced by questions that may be asked by the patient or request for information by the patient. There are many more problems that can be there and the diagnosis that can be formulated. Thank you very much.